Welcome to Season 2 of Rural Health Today. While we're not quite finished with our maternal care season, we just couldn't wait to share the series of amazing conversations with our listeners. This season is called Rural Health Summit because every episode comes directly from a conversation I had at the recent annual meeting or summit by the Michigan Health and Hospital Association. Each guest is an attendee of the annual summit, and the MHA was gracious enough to let us record these conversations, which will greatly add to the value of our community hospitals across the country. This season is also a summit season because of the nature of the discussions. In each episode, I'll ask my guests to give us an update on their hospital or healthcare organization and touch base, so to speak, on the healthcare issues they see in their community that's most pressing in their corner of the rural health world. And now, to kick off our summit season, I'm excited to welcome our first guest. Hello, today we're talking to Bill Manns, president of Bronson Health. And Bill has been a friend of mine for many years now, a solid leader, cut his teeth in Michigan, and is continuing to lead an amazing institution, Bronson. I'm always excited to review your annual report, always excited to look at what's exciting on your 990, and then as well as to just see what you're doing in the community. And you've really encompassed a lot of, as we look at social determinants of health. You've done a great job at that, Bill. You've been a spokesperson for that. You've also led several initiatives in your greater service area. And I would say that you're the premier hospital. And a lot of people are saying that because there's a lot of competition around you. But it seems like from the data that I'm looking at that a lot of the patients are migrating towards Bronson. So congratulations to you. That doesn't happen overnight. It happens with a strategic plan that you've built and your team. I think you're going to continue to build. Hopefully, we'll hear some great stories about what's exciting for you coming up into the new year. But, I want to start first just by, for those listeners who may not know who Bill Manns is, why don't you give us just a brief overview of your background and what is Bronson Health trying to achieve?
Well, first, JJ, my friend, let me say it's good to see you.
Good to see you.
Thanks for having me on. So, my name is Bill Manns. I'm president and CEO at Bronson. Originally from Detroit, born and raised, went to a all-male Jesuit high school, so that notion of values and really being community-oriented resonates with me and it's part of who I am as a person. University of Michigan undergrad, University of Michigan graduate school, so I do bleed a little maize and blue. Had just an amazing career. I'm fortunate and highly blessed when I look at my career over the course of the past 15, 20, 30 years. When I think about where I currently am, being the CEO of Bronson, in so many respects, it's a dream job. Mm-hmm. I know we're going to get into this later, but to be in our seats, to be CEOs where we have responsibility not only for trying to run a business that has a bottom line so you can reinvest, but also doing the right thing for the community from a social determinant perspective. So, me, again, I love the job. I hate talking about myself. But love talking about the team at Bronson and the good that we're doing. Yeah, amazing team. I remember my first lunch with you in Lansing. I went home and I told my wife, man, this guy's, he's just solid. He's principled. And I think to your point, for such a time as this, we've been called, these are some pretty tumultuous times. I think they brought back the word unprecedented is now in our vocabulary. But, we'll have plenty of time to talk about the future. Let's talk about the takeaways from your organization in the past year. What have you been most excited about that your organization has done? Maybe it's a project or maybe it's just a continuation of great healthcare services. But why don't you give us insight? So there are actually a couple things that stand out for me. And it goes to what I was just talking about, finding that right balance, right? So Moody's just upgraded us from an A2 to an A1 organization.
Congratulations.
Thank you. Based on financial performance. And for me and the team, it's about how do you drive efficiency? Right. I get it. I mean, healthcare is incredibly expensive, and we hear it all the time. But how can we be a more efficient, responsible organization? Yeah. And the second thing, and probably more importantly, last year we provided $147 million worth of community benefit.
Is that right?
147.
That's got to be some of the largest community benefit I've seen in the state.
Yeah, I mean, you think about it, it's $403,000 a day.
Wow.
Yeah, and so those are the two things when I think about Bronson I'm most proud of, as often health systems are the largest employers in their region.
Right.
We're by far the largest employer in Southwest Michigan.
Yeah.
And with that comes that responsibility.
It
is.
It is.
I said two, but I'll throw in a third. So we were named one of the best and brightest healthcare organizations to work for in the state.
Congratulations, man. I can see why.
A lot of cool
Great leadership at the top. So let's talk about the size of your hospital. Just to give perspective. Yeah. There's folks listening across the country. Talk a little bit about your associate members and how that operates.
So let's see, we have 9,331 FTEs.
That's amazing.
A lot of people. 4 hospitals. So we have a hospital in Battle Creek, Michigan, a hospital in Kalamazoo, Michigan, hospital in Paw Paw, Michigan, and a hospital in South Haven, Michigan.
Wow.
Recently, we did a JV with an organization called Acadia for behavioral health.
Oh, okay. I did not realize that.
Yeah.
Okay.
98-bed behavioral health hospital.
Now, were you already a behavioral health at Bronson?
Slight.
You had some beds?
Yeah, we had some beds. We had about 10 beds.
Okay.
And so we've increased that
to 98.
98.
So that's a region. Is that the regional one?
No, it's not.
Okay.
So the regional one you're thinking about is probably Kalamazoo.
Kalamazoo, yeah.
Yeah, so that's state run.
Okay.
This is, like I said, it's a venture between us and Acadia. So.
Is that right?
Yeah.
So 98 beds?
Yep.
That's a hospital.
Yeah. Oh, yeah.
I mean, I have 100 beds. That's a hospital. That's incredible.
Yeah. I mean, when you think about access and the paucity of behavioral health beds in our state.
Yeah.
Right. It's
huge
really
crisis
important.
now.
So we're stepping up to the challenge.
Yeah. Bill, speaking of challenges, let's talk a little bit about, we have to get real with some of the challenges that we're facing. So, individually, your institution is doing remarkably well, as evidenced by your pillars of growth and finance. But let's talk about the challenges that we're facing into the very near future. It's very serious. And both you and I have talked about, political leanings, and we've both talked about some of the challenges that we face as politics comes into play with our jobs. But this is unprecedented time that we have witnessed. And so I want to talk a little bit about some survival mode that a lot of our rural hospitals are on. And I know you're an institution, but you have small hospitals that are part of your institution. And those are in jeopardy right now. And so there's a storm right now that's on the horizon. It's a big one. Talk to me about that. Where's your perspective?
Yeah, no, thanks, JJ. So, I am one who generally, I sleep well during the storm, right? Because, like I said, we have an amazing team. We've done a lot, and often I think we're prepared. But to your point, this is unprecedented. I mean, we've got a man-made tsunami.
We do.
So this is not...
That is true.
Yeah, it's not your usual storm, right?
Yeah.
This is something that was created, something that, from my perspective, really could cost people their lives.
It will cost lives.
And you think about the livelihood back to being a large employer.
Yeah.
It's not that we can just continue to trim or become more efficient here or there. We're always doing that.
Yeah.
I mean, you're a healthcare leader. I'm sure you're doing it at your organization. But to have this kind of threat on people's insurance.
Absolutely.
Right? I mean, it's unconscionable to say, we're going to take someone's insurance away.
Yeah.
We're going to take their access to healthcare away.
Yeah.
We don't care if they suffer and die. So
it's very true.
For me, is unlike anything I've ever seen or anything that I ever thought I'd see in my career. And so I'm very worried. And I appreciate your advocacy. I appreciate you sounding the alarm. I think often people think, oh, it's just rhetoric, or, gee, those guys don't know what's going on.
Right.
But when you talk to patients, the fear of losing their coverage, the fear of losing your insurance, I mean, I think that's something that should resonate with everyone.
Bill, and I think in your rural hospitals that you oversee, you probably have a population similar to mine where 40 or greater % on Medicaid represent that patient panel. And then in your you're still running obstetrics, which is noble of you. Yeah. But, that can be in our rural community, 70% of our payer mix.
Yeah, no doubt. I mean, when you think about the state of Michigan, right, almost half the kids have Medicaid.
Yeah.
And so when I think about our 2 rural hospitals, it's going to have a devastating impact on those hospitals. And, they're part of a larger system, Bronson. I get it. But those losses and what it means for that community.
Yeah. Something has to be cut in order to sustain your hospital at the level it's going now. And programs in rural communities where they do not have the mothership like you are. You're the Bronson mothership.
Right.
And you have the luxury of being able to carry some of those rural hospitals. When you're an independent, like myself, it's about programs. It's about access. And we've said it here this week in our series and summit that it's cuts to Medicaid is cuts to everyone.
Oh, yeah.
It's not just the Medicaid patient. It's when those programs go away. So we have a significant challenge ahead of us. I would encourage our listeners across the country, reach out to your congressional leaders. Lack of access means lack of care. And so we would encourage you to lift up your voice. It's critically important. Bill, you're doing that. I think there's certainly a push in Michigan among our Michigan Hospital Association. They do a great job, don't they?
They do an amazing
Let's put a plug
job.
in for them.
Yeah.
Why don't you do that? You've been past chair. You've been, come on, talk to us.
Yes.
Not soon to be chair.
Yeah, no, exactly. I'm very excited about it. I mean, the team at Michigan Health and Hospital Association is second to none. Brian Peters, their ability to work with
incredible
across the aisle, it doesn't matter. It's about the issues, right? And really helping healthcare be more accessible, higher quality for all Michiganders.
That's right.
So I think the team, they do an amazing job.
They do. And so, Brian, the baton is being passed tomorrow. Thursday night. You will become the incoming president of our board. I'm excited. Your leadership is amazing. But if you could look into the future, I want you to look at it in two perspectives for us as we wrap up today. Number one, from MHA, what are your goals as our leader? And number two, for Bronson, what's exciting for you in the future ahead?
Yeah, no, thanks for that, JJ. So from an MHA perspective, I do think we need to continue to use our voices, right? That authentic voice coming from the people who do the work is going to be incredibly important for us to continue to ensure that all Michiganders have access to health care. So I think that's huge for MHA.
It is.
For Bronson, really excited about Bronson's future. We're making some.
I love the smile, by the way.
Yeah, exactly.
Because you're not going to release everything you're doing. I know you're not. There's some things in there.
You're a smart man. No, I'm not. But I mean, what's really cool. So next year is our 125th anniversary.
Congratulations!
Yeah,
that's awesome.
We're leaning into that to be the preferred provider for that community for 125 years.
That's amazing.
So we're going to make a big deal out of that. We've got some service line expansion that I'm excited about.
I'm going to have you back on the podcast for that, okay?
Exactly.
All right.
I'll share a few more secrets.
Okay, all right.
Before
off the air. Okay,
exactly.
All right.
But I think Bronson's future is incredibly bright.
I would agree.
We're continuing to get market share, and the momentum's great, and it's because of the people who work there. And the people who work there care about their community.
Yeah.
And you feel it from myself throughout the entire organization.
Yeah.
So really happy to be in a position to help provide health care for our community in Southwest Michigan. I'm
excited for you, too. My chief quality officer every quarter gives me the market data.
Yeah.
And the first place I go to is Bronson. I look at how well you're doing. You're taking the lunch off a lot of tables, and you're doing it for the right reasons because you're delivering quality service at a price point that is very important. And as we all are faced with making some tough choices, you do it very well. High quality. And it's reflective in the fact that you have a margin. When you have a margin, you have a mission, and your mission is very noble. So keep up the great work. Bill Mance, it's been great to have you on the podcast today. We're going to have you back to talk about some of these exciting things.
All right, my friend.
All right.
It's always good seeing you,
Good
JJ.
to see you too, Bill.
I appreciate all that you're doing.
We appreciate you.
Your voice.
Thanks for joining us today. We've gained so much insight through our Summit series, and we hope our listeners have too. Let us know if you've enjoyed the series in a podcast review or email rulehealthtoday@gmail.com. Until next time, remember the power of rule. And thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcast. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com, and make sure you've subscribed to the show so that you never miss an episode.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.